but I would like to introduce myself. My name is Tino Gesualdo, and I am a full professor of nephrology, working at the University of Bari, Italy, and I am the project coordinator of NPAT. If I can have my first presentation, NPAT stands for Nephrology Partnership for Advancing Technology in Healthcare. You can see this is our website, www.npat.eu, that please, try to surf it because there are, many information for you. And today we have our multiplier event. The multiplier event is a meeting that would like to share our knowledge with the other one. Also with colleagues that are not involved in NPAT, because Dr. Giannini reported that the mission of the European Community is to share knowledge and to create networking, and especially networking between higher education institutions, universities, and small and medium enterprises, so business industries and all, the stakeholders that are involved in this field. So why we build up this consortium? Well, these are our numbers in nephrology. 850 million people worldwide have kidney disease, more women than men, 12% versus 10.4. And if you see our number and we compare to other disease, diabetes mellitus counts 422 million, so we are double. And cancer 42, HIV 37 million. These data were presented by Dr. Okusa in the ASN, but were reported by Dr. Jagger, that is Katie Jagger, that is our colleague that is running the registry, the ERA registry in Europe. So chronic kidney disease, as you know, is becoming a social problem that involves not only nephrologists, but also GP, general practitioners, as well as other specialists. We know that this is a progressive disease that is often linked to risk factor as hypertension and diabetes, which in the last stage requires dialysis or transplantation. And we know very well that an early diagnosis can allow an adequate management of the disease in order to slow down its evolution toward the more advanced stages. Now the question is, the numbers are high, 850 million affected by CKD. But why we are getting a new syndrome? We are getting a new nephrologic syndrome that is called acute fellowship insufficiency. So we were asking us why we are getting this problem, since there are so many persons in the world that are waiting for our support. And if we see the residency program, these are a residency program in the States. As you can see, there are more than 51% of program and 68 out of 134, and at 32% of position, 120 out of 374 that are going unfilled. So we are not attractive. Nephrology is not sexy. Why? So we should ask to us. I was, in charge of a residency program in my university, and I was asking to myself, why our residents do not like nephrology? So we should actually review this point. Now, the situation is not the same in all countries. There are countries where, for example, Spain, Greece, Italy, where there are a good number of nephrologists per million of inhabitants, per million population, running between 40 and 50 per million population. But there are other countries, such as UK, that there are only 8 per million population, almost nothing. Maybe different health system, organization. By the way, as you know, Dr. Sharif reported in Clinical Kidney Journal, global expert group predicts reduction in the nephrology workforce over the next decades with potentially serious implications. Multiple factors are responsible for this, although the reason may vary in different countries. Now, let's try to review the most important reasons that are giving shortage to nephrology. First, lack of exposure, probably. So we will discuss this together. Lack of exposure to nephrology among students and residents. Maybe we needed to work in the medical school, trying to let understand our medical students how it's important, nephrology, since we have 850 million of persons that are affected by renal diseases. Second, decline interest in nephrology among trainees. So we did it, for example, in Italy, a survey, and we realized they asking us more practical courses, more practical events. And inadequate training, are we missing mentors? You know, the residents like to have the good mentor, the mentor that is challenging the residents, the mentor that is pushing on him. And maybe, and we should think about this point, maybe erosion of nephrology practice scope by other specialists. Let's think to the ICU. Let's think to the cardiology. Now cardiology, they are pushing a lot in the endovascular approach. And the cardiosurgeon, they don't like it too much. So it's time that we wake up, I think, and let, become nephrology more sexy. So what can are the strategies for recruiting excellent fellow in nephrology? I think that all of us must ensure that those who complete training are highly skilled with expertise that distinguish nephrologists from other specialties and prepare to translate new knowledge into improved outcomes for patients with kidney disease. We needed also to train mentors. Excellent teaching and mentoring are the most important factors for the satisfaction of fellows. The fellows are looking for mentors. They needed to be trained by the right mentor. And maybe we need to establish collaborative network. Is what we are doing today. We are doing networking among Europe. We needed to develop together a core curriculum, the same that should be applied all over in Europe. And in this, we have on board of this consortium two European society, the ERA, and I welcome Dr. Fontana, and I thank, Dr. Fontana and her staff for all she is doing for us. And she was organizing this beautiful event here in Parma. So we have the ERA, the European Renal Association, and we have the VAS, the European Vascular Access Society, that can spread this knowledge. It can help us in building up a core curriculum that we can share with our university. The consortium has inside 8 universities, 2 small and medium enterprises, and 2 European societies. Very nice group. Working together, making networking, trying to revitalize the joy in the practice of nephrology and convince trainees how exciting a career in nephrology can be. So I welcome the 40 residents that are today, with us, because they connected. How many participants do we have now? The backstage, can you give me a number? In this way we can say hello to everybody, because this is an hybrid format. It's not easy, to communicate, but it's also informal. We are here to make a networking. This is the main goal, trying to get the right networking that should revitalize the joy in the practice of nephrology. So how many participants do we have it? Here we are almost 20, 15. We are 15 in presence, 45 and 45. So we are 60. Very good number. Very good number. This is for us is a success. And we have also, the residents that have been selected, and we will see. Huge success, 23 countries. So that is very, is a very, very nice results for us. Very good. So what the core curriculum should have in? What the residents is asking to us. By the way, since we have residents together with us in this hybrid format, we should discuss also with them. They can ask, because we can improve, our NPAT program, because if they can send us suggestions, and we will try to accomplish what they are asking to us. Should be, a very dynamic course. So the core curriculum in nephrology should have in pathophysiology of renal disease, AKI and CKD, should have, knowledge regarding renal replacement therapy and end-of-life care, a sound knowledge of measure randomized controlled trials and international national guidelines in the field of nephrology, dialysis, and transplantation, clinical pathological correlation, case studies. They like it a lot. I saw my resident, they want to discuss the case, what I should do first, what I should do in this patient. I would like to know how to treat him. And what we are doing with this course, procedural skills, ultrasound, renal biopsy, insertion of central catheter, PD insertion, are all procedures that the residents wants to learn. And I would like to know from them also why they have participate in our program. That should be nice that, somebody of you will, write us on the chat, or maybe I don't know if they can be connected by voice. I don't know if the platform able them also to get in with voice. We will say, later. And we needed also to build up in Europe new research facilities and educational facility where to train these people, because not a lot of us have the possibility to have the right environment where to build up, expertise. So it's time that we train the next generation, and we needed to let them become enjoy what they are doing. Well, not saying, a nephrologist as a superheroes. The nephrologists that save, lives. So this is our mission. And, I choose nephrology because I was pushing myself, on this. I was saying, I want to be a nephrologist. Why? Because there is so much to do it. Let's do it. So, and this new generation should be trained also on what is on the stage now. Artificial intelligence, augmented and immersive reality, simulation, and navigation. So once again, please go on our website. You will find all the information when the program starts, what kind of path is inside, because we have now the first European advanced training course in diagnostic and interventional nephrology. Will last 2 years. What are the main goals of EMPATH is refreshing the clinical scope of nephrology and promoting the nephrology careers at the European level. It would like to develop a multidisciplinary educational path with patient-centered approach, focusing on interventional nephrology, and will foster the knowledge transfer between academia, universities, and business sectors, small and medium enterprises, in order to tackle the risk management in health care. Think about it, risk management. Why using phantoms? Why using a procedure, interventional procedure on phantom? To reduce risk management. They want to go first on phantoms and after in the real life. This can train the fellow better than what we do. This is our consortium. As I was saying, 8 universities, University of Bari, Amsterdam, Prague, Maastricht, Patras, Barcelona, Parc Taulí, University of Milan, Ljubljana, the ERA, the European Renal Association, the Vascular Access Society, Eureka, that is our small and medium enterprise, our partner, that is developing a very dynamic and updated e-learning platform that all the residents will use in the next 2 years, as well as EMAC, that is a small and medium enterprise that will introduce themselves later, that is supporting us with all the technology that we needed to train the fellow that are getting inside of our program. These are the curricula, 4 curricula. The first curricula is REMAP, is called REMAP, is a renal expert in renal molecular pathology. The second curriculum is renal expert in vascular access. The third curriculum is renal expert in medical ultrasound. And the fourth curriculum is renal expert in peritoneal dialysis. And you see what, you will learn, what, the fellow will learn regarding each path. What is the methodology that we are using? Is a blended technology, is a blended learning approach where there will be face-to-face learning, meeting in several sites, as well as online learning using an e-learning platform. Moreover, we will use modern facilities, experienced tutors, cutting-edge simulators, and augmented reality tools, as well as e-learning platform regarding the online learning, e-learning platform, unpublished learning materials, expert live discussions, and customized mobile app. What we will release at the end of the program? Of course, an e-learning platform that, since we have been granted by the European Community, will be open access, so will be available for all. During these 2 years, only for the fellow that get it inside of the program. And this fellow will get also some academic certificate with 29 credits, university credits. The ENPAT goal is to make nephrology career more appealing, more sexy, by creating a community able to engage thousands of nephrologists worldwide. What we have done already? Well, the first kickoff meeting, we held the first kickoff meeting in December 2020, the 16th of December, we started. And actually, we launched the application call for the students, well, actually for the residents, I should say, that are also students, but our residents, our trainees, was launched in May, and between July and August, we selected the 40 trainees, the 40 residents that got inside of the program. And with this, I thank you for your attention.